Welcome to Hope Village Podcast. I'm Ricardo Handy, and before we get into our episode today, we had planned on doing something to promote and talk about the May 12th release of Hope Village Project, which you can still go to our website and get. But with the COVID-19 pandemic happening right now, we have shifted our attention from Hope Village and recovery specifically to how can we help everyone in our community, all of our listeners, everyone that hears this podcast, get the right information. And so with that, Lucy will tell you about what we have in store for today's episode.
Hey, everybody, I'm Lucy and excited that you're joining us today and more excited about the information you're going to get today because I believe knowledge is power and we're so excited to bring to you some experts in our field, some doctors who are going to join us and not just answer our questions, but be willing to answer your questions as well. Because I know the only way we stay well is to stay informed. So stick with us. You are in for a treat. Like he said, we've got to address what's going on in our crisis in our nation right now. And so these doctors are joining us today to talk about COVID-19 and how to stay well.
Yeah, so if you have questions as you're listening to the podcast today, you can call 805-391-4973 or send us a message on Facebook or on our IG at Hope Village Project on IG, on Instagram. So let's get right into Hope Village Podcast today, and we hope this information finds you well. My name is Ricardo Handy. I'm a filmmaker. I was recently inspired to make a movie about the life of Lucy Hall.
I always tell the women my story. I used to smoke crack in the bathroom. Today, if you go to my house, what's in the bathroom is my Bible. Because I had to put something in that place that was greater than what used to be in that place.
Her story has inspired thousands of women to get on the path to recovery and change their lives forever.
Like I always tell the women in recovery, now you're the disciple that got to go share it.
Amen.
You're the person who's got to go tell your story. You've got to be an advocate.
In this podcast, we will go in depth with Lucy and the recovery community at large.
You shouldn't have to get arrested to get well. If the community and the place where you grew up and the place where your family lives isn't going to be about redemption, who is?
You are tuned in to the Hope Village Podcast. Stay tuned to find out how you can see the movie Hope Village and get Lucy's book, The Complete Guide from Rehab to Recovery.
If I can put a Hope Village in every town, we'd be in business.
Well, welcome everyone to the Hope Village Podcast. Again, I'm Ricardo Handy, and today we have a very special and important episode in the midst of the coronavirus pandemic and, all the orders to shelter in place. It's nearly every state. I think we're up to 40 states that have the order in place at this point. And so we felt it was important to kind of pivot what we normally discuss on the show, which is recovery. And we will get there right now, but we're right now still in crisis mode. And so while we're in crisis mode, we invited some doctors on, friends of mine, actually. Fortunately, I had some doctors I could call when I have questions. And so I wanted to just be able to extend that opportunity to everyone. Lucy and I will just go around and have them all introduce themselves right now so we can get right into it. And I asked them to all share, one thing that has changed or shifted, or one thing they want to share, about what's going on as far as medical and their patients right now. So we'll start it off with Dr. Bryon Patterson. So just tell us a little bit about, your practice and what you're seeing during this pandemic right now.
Well, thanks for having me, man. So I finished my fellowship in 2003 out of UCLA. Started my own primary care sports medicine practice in LA. And I initially did a residency in pediatrics and then did a fellowship in sports medicine. So we've been building up, focusing on taking care of the well-being of everyone. I feel like everyone is an athlete, whether you're a professional or just your run-of-the-mill, hardworking individual that go to work every day. Just to kind of focus on what's important, I think from my perspective, right now, because of lack of testing, lack of doing antibody testing on everyone, we just have to assume everyone has it. we just have to assume everyone has the virus, and that's how we have to treat each other as we go around in the community, also at work. So a lot of my patients are concerned that, should they be coming in just to get seen for an acute injury? And I tell them yes, because it's better than to go into an ER and urgent care where they potentially can be exposed. So I know we're going to talk a little more about it, so I don't want to take all the time, but we can pass it on from there.
No, that's great advice. Very, very poignant advice. Let's introduce the other doctors on the panel, and then we're going to get into some more conversation about that. Branden Turner is also a doctor. Go ahead and introduce yourself and tell the folks about what you've seen so far.
Hey everybody, my name is Branden Turner. I practice family medicine and sports medicine at Kaiser in Baldwin Hills. I think one of the important things in this pandemic is your other medical issues don't go away. So if I was to charge folks with anything, if you have diabetes or if you have hypertension or high cholesterol, this is the time when you need to double down and make sure you are taking those medicines, because you don't want a diabetes flare to be the reason you end up going to the hospital and to expose yourself to this virus if there's things that you can do to prevent that from happening.
No, that's awesome. That's another piece of great advice. Well, one more doctor on the line. Go ahead and introduce yourself.
This is Dr. Archione, Britton, DC. I'm one of the few Black chiropractors you'll ever meet. And okay, good. Basically, we practice in West Los Angeles, and my main goal is serving the community. As I've done my postdoctoral work in neuroscience, we handle mostly people who have severe acute injuries, like Dr. Patterson and both Dr. Patterson and Dr. Turner were saying. And one of the things that we're looking at is, as the hospitals fill up, what kind of acute physical injuries can we help people with? And, obviously your diabetes doesn't go away. Those other things don't go away. So my main goal is to have people who are in acute injury get in where we only have one person and one attendant. So that way there's not too many people gathering, and, follow the rules. Right now we're in an area of what to do. Really seems like work together as a community and try to get the right information out. And that's the best I think we can look for at this moment.
I want to go back to what the first doctor said, because I thought it was so spot on. And I would love for him or one of you to elaborate a little bit on that. And that was, he said, treat it as though everybody has it. And that is so, so very true. I was told that by the medical professional that I went to see. They were like, Lucy, we can't test you, but I'm going to treat you as though you have it. And I was like, oh, that kind of scared me. But at the same time, it was like, okay, if that's the case, then what do I need to do? And one of the biggest things and the hardest things for everybody is to stay home, is to stay in. But we know that if we're going to win, we've got to do exactly what we're being told to do. So I'd love for you to elaborate a little bit more on that whole treat it as though you have it. I'm one who believes prevention is better than medicine. So I stick with taking vitamins. I am on no kind of medicine at this point in my life. And I think that's a blessing, because I do believe in prevention. I think everything is preventable before we get to treatable. And so I would love for you to just speak to that a little more as it relates to when you say treat it as though everybody has it. Tell me why you say that.
So the reason I say that is because we just don't know. We don't have the testing out quite yet. We don't have the antibodies to know if you've already had it or not, testing. So in this case, to kind of control that curve, to lower the curve to the best of our abilities, is to really practice social distancing, doing the 6 feet, wearing your gloves, wearing the mask, not necessarily a medical mask out in public, but at least covering your face, really avoiding large groups, doing the things that we know can at least inhibit the spread of the virus. And until we get caught up with the testing, this is the best way we can kind of decrease that rate of infection, because we just don't know. We have no clue who has it or who doesn't, because it's a silent carrier for a lot of people. And two, they start getting the symptoms, and that's what's so scary about this virus. And I'll let the other guys talk in or chime in on that.
Yeah, I think
So my doctor from Kaiser, go for it. Thank you.
And I think the most concerning thing, and what Dr. Patterson was alluding to, is that we have this assumption that everybody who has this virus is super sick and calling their doctor and going to the urgent care and going to the ER. I would argue that probably most of the people who have the virus are just walking around, because most of the cases are going to be asymptomatic. So it's not going to be people who are coughing and sneezing and having fevers and having body aches. Most of the people are just the folks who were just walking around the store. And I think that's why it is important to treat it as if everyone has it. Because not everyone is going to look like what we expect all these people to look like on TV.
And Branden, I believe when we spoke prior to the podcast, you were sharing just something really important, I feel, about how it's actually transferred, like how people actually get it. And you said something about droplets versus
So we were discussing airborne versus droplet. So airborne is like, I am breathing on you and you get it. And for a lot of concern for how this is spread, I think what is more concerning for me is the droplet part of it. So it is partly concerning that a sick person might cough on you, but it is more concerning that that sick person might cough on their hand and touch a door handle or touch a table. So I think that is where making sure you're keeping up on your hand hygiene is important. Because I think this goes back to the initial point. Most of the people who have this are not walking around and coughing up on people's faces, but it is them coughing on their hands and touching other things that are kind of more in that public sphere. So that's the part, the droplets landing on surfaces part, that I think is the important part not to miss.
So tell me this, because like many people, I'm sure, have the question as it relates to, so if I have it, how do I treat it? And I think that's another major concern of our communities. It's okay, like you said, if you're not in the hospital on a ventilator, because I have to say I'm a person who has had, I went to Kaiser and 2.5 weeks ago, I went to Kaiser because I started getting chills. And literally, it was like at nighttime when I laid down, I had to get up and put sweats on, blankets. I was like, what the heck is going on? It really got scary. So, of course, my daughter, who's in New York, she made me call Kaiser. And of course, my doctor said, come in. And when I went in, they did, okay, all of the symptoms, you got the flu. But we're going to do the chest x-ray. And with the chest x-ray, we found out that I actually had pneumonia. And so they treated me with an antibiotic, and by the grace of God, and thanks be to God, I kicked sickness out of my house and was like, okay. But at the same time, now I have this, I'm not going nowhere. I ain't going out the house. I ain't going nowhere. If it ain't up in here, I won't have it. And I think that's the thing that people don't realize. One, like you guys have said, you don't even know you even have it. And two, what's the treatment for it? How do you get better? How do you take care of yourself and stay well? So what would you say to that?
Well, I would say as of April 5th, 2020, there is no FDA approved treatment for this virus. So I would throw it back to you, Lucy. The first thing you said when we started is, I am a believer in prevention. And I think being in a room with 3 medical professionals, I think we would all agree the best way to treat this virus is for you to not get this virus.
Amen, sir. Amen.
I think Bryon was going to also jump in on that as well.
No, I was just going to add to that, and to really think about, not only do we are at risk for exposure, but in the African American community, we probably experience the highest mortality rate on top of that. And part of that is our mistrust in the healthcare community and profession as a whole. You were smart enough to at least go in and get seen and get diagnosed with pneumonia, where a lot of our folks, was told misleadingly on the internet that African Americans can't get this. And B, a lot of our folks just don't trust the health system. And so we stay at home when we should get checked out. So when you should call your physician, or you should go to the ER if you are having shortness of breath. Most, like we were saying, there is no treatment, but at least if you can start intervention to support your breathing early on, that may lower the mortality rate for a lot of our folks.
And that's
Ricardo,
go ahead.
Ricardo, I just wanted to step in on that, especially when we're talking about prevention. Coming from a holistic model, you look at prevention, there's chemical, there's physical, and there's emotional, right? And so right now, what all the physicians are both saying quite accurately is we don't have a quite quote unquote chemical preventive model yet. They don't have a cure. There's nothing like that. But we all know that being stressed, reacting to a condition from a panic point of view, all those things are going to both, one, make you make wrong decisions, decide not to follow through, increase the, what they call it, cabin fever. And again, we know if we only do part of the people stay home and the rest don't. So we've got to deal with both the idea of the emotional stress that's going on because of the activity people are going to decide to or not to follow when they're under emotional stress. And we can also deal with part of the, when we look at the preventative side, we can look at the idea of movement. Now, I don't mean to go and get in the gym. They've already said not to do that. But overall, getting the things in your body moving correctly, because your nervous system, your immune system, those two things are working together. And when we look at these people that are getting sick, we're saying people with diabetes, people with chronic kinds of diseases have a higher prevalence. Doesn't mean that's the only people are going to die. But what we end up seeing is people whose bodies have a difficult time already with the immune system. A friend of mine had a kidney transplant. He's got no hope except for that we follow through and we succeed with this social distancing. He's not going to have an immune system someday, maybe, because that's the way it goes with these kinds of transplants. So I say we end up looking at things. It's really hard in this environment. I saw someone getting in trouble for suggesting things, but I do think we can do things to improve our mental health. We can do things to improve our physical health. Or we can end up looking at whether it's movement, whether it's Pilates. For some people, they're coming in, they're just getting adjusted for some kind of normalcy and then getting away with flyers and information on that. But I think there's right now, while the chemical side, while the biochemical side is figuring out what it's going to do to create a vaccine or whatever like that, we want to sit with the idea, look, there's a lot of people out there who are watching their bank accounts go to zero. And listen, all the stay in you can say all you want. But when it comes to, am I going to feed my child or am I going to risk getting sick? You know, it's kind of an interesting conversation. And our group have had to add those questions for years and years and years. So I think we have to address that mental side, or we're going to kind of miss the button. So that way we can actually practice what we need to do until the chemical side gets involved and has a vaccine or whatever it's going to do.
Yeah,
no, that's a great
point. Go ahead, Lucy.
No, I was going to say that's a great segue because I think mental health is a major piece to this as well. And I think resources within the community, I know I'm here in Atlanta and you guys are in LA, but I do hear tons of churches still being the church by providing, resources to people so that they can eat, and I think that's important that people still remain healthy and be able to access resources to be able to eat. But I also would love for you guys to talk a little bit about the mental health and the physical health as we are sheltering in. What would be some of the things you suggest that people do to take care of their well-being, their both mental health and their whole physical health, so that it does stay healthy? I mean, like I said, when I had pneumonia, all I could do was go from couch to bed to couch for like 5 straight days. But the minute I was able to go get on that elliptical machine, and the minute I was able to do certain things, and I am getting a little cabin fever, but I ain't that crazy enough to say I'm not going out the door. So for real, I went to clean off the back porch, and there was so much pollen out there in Georgia. It was like, yo, not today. But nonetheless, tell people what are some of the things you would definitely recommend that they do to stay well, mind, body, soul, and spirit.
I guess I'll start off. I guess I'm the old one in the group. I think exercise, period, is important. It's a good form of medication, so to say. And what does that mean? It can mean that you go out on a walk, make sure you're just keeping your social distance, getting on a bike, if you have a backyard, if you have access to workout equipment, but we all are not blessed to have those things. Being able to do indoor Pilates or yoga, I think is important also. There's a lot of now apps on the internet that you can download to also facilitate you in working out inside. But yeah, I think whether you put 30 minutes to 60 minutes a day of increasing your heart rate, is really important that you guys follow that on a daily basis.
I want to add to this part of the conversation, just kind of the part that has us all, folks mentally strained, because a lot of people do have that dilemma, right? Of like, I need to go to work, right? Or if I don't work, especially folks in service jobs. Specifically, there's a gentleman who passed away, a bus driver in Detroit. And we were talking about this before the call with Lucy. I hit her with the stat that I just heard in Detroit. There 14% of the population there is African American, yet 40% of the deaths that have occurred are from coronavirus are African American. And we were speculating, was that because these folks are like the bus driver having service jobs, they need to work, different things like that. So my question ultimately is as African Americans and as people maybe that are underserved, or that need to still work, or even for yourselves, you guys still have to go see patients. What advice do you have for folks that have to go out there in the world every day, and maybe concerned about that? And then also for folks that, have concern for their loved ones, you know what I mean? Like just the mental health of that whole situation of needing the world to keep continuing, but also protecting yourself.
Well, I guess I'll go ahead and jump into this fray a little bit, but I want to be real clear. I would never consider myself, I'm not a coronavirus expert, nor am I a virologist, nor am I an epidemiologist, right? As someone who's in the healthcare profession, trying to be on the front lines and take some of the things off the people's cases, one thing that I do talk to even my other providers and other physicians about is, though this is a virus, there was never a time which before this when we said, taking B vitamins is not a good idea, right? For energy and also for the ability for your body. Is this going to fight the thing? No, but it can help with some of the mental stress that you're going through. Also, when you look at a lot of these studies, many of these people who are passing away are having things where you're seeing the mitochondrial failure, the failure of the mitochondria of the person's cell. So, wherever you are, even for the medical physicians, doing things that are good for the body to help create energy, just like you said, for exercise, for myself, old stuff, guys, vitamin C, cod liver oil, because we're talking about inflammation that's just gone astray. Now, the virus is causing the inflammation, but it doesn't necessarily, for those of us who are having to go to work, when you have to go to work and there's no cure, doing the things that you probably read about when you were in second grade, making sure you eat your oranges, get your vitamin C. You know what? We're dark skinned, and I'm going to break into something that might turn off some of our Caucasian population, but this skin filters out some of the things that allow us to produce vitamin D. It causes us to have different disease. Anybody's been in med school, normal, who's going to get cancer? Who's going to get diabetes? Who's going to get kidney? Who's going to get coronavirus now? We're just on another list. So there's a part of, I'd say, the healthcare administration that we still really haven't peered into what's unique about the African-American health system that might be different than maybe other causes. And I don't know if this is the place to get into that, but for them, vitamin D, guys, why? We're fighting inflammation. Now, there's a virus, just like there could be a war, and then there's the problems that the war causes. Not enough food, not enough clean water, not of all these things. That's what's happening to the body. Is this going to cure anything? No, but for people who might be carriers, or there's plenty of people, like Dr. Turner said, who are going to get it, have almost no symptoms at all, but they'll still get things that are like flu-like symptoms. I don't think that piece needs to change for us. We don't have to reinvent the wheel on helping your own immune system. We just have to actually start doing it. And listen, I mean, my family's from Georgia and Alabama. The food we eat, soul food, that there's nothing in the soul food that's good for anything but the soul, right? The sugar, the carbohydrates, the excess. No, there's not a doggone thing. I think for our population, we could really look at taking an opportunity to try to, by the way, I'm vegan and I don't eat things with gluten or like wheat products in them. So so I'm saying what I am. But changing that took me having a health experience, a really bad one. And for me, and seeing what happened in my family, I think we could all look at changing what kind of foods we eat. I mean, Tupac said it and we never changed a minute. We got to change the foods we eat. We got to think of consciously, what do we want to put in our bodies? If I go to the store, guess what? None of the foods I'm looking for, the tofu sour cream, still full. Right? The vegetarian pasta, still there, right? Now, am I telling you guys people that they should follow only that diet? No, it's about health in general. we're getting hit because
Yeah.
we spent the last 50 years not eating very good as a community.
No, I mean, it's important. Eating healthy, definitely. My wife's a dietitian, and we definitely have had, many conversations about just eating food as medicine versus eating food for enjoyment.
Mm-hmm.
And I battle that, on a daily basis. There's a lot of things that we do because we want to enjoy, right? But then there's a lot of things we need to do in a certain way because they're more important for our health. And so, food is medicine versus food for enjoyment is one thing that I think Black folks, lean towards the enjoyment part for sure, because we make good food.
This is a very, I have to say, this is a very unique opportunity to have 3 Black male doctors on this podcast. And I'm honored. And let me tell you, brothers, that up front, I'm truly honored and always want to give brothers kudos because I know the plight of a brother. With that being said, though, I definitely want to hear what you think about as it relates to where we are now and what does this look like in the April, May, June, I mean, where do you guys see it, or where do you guys see us turning a corner in our nation? Because I think every one of us wake up every day with Groundhog Day feeling. It ain't over yet, every freaking day it's Groundhog Day. And so I would love to hear, your thoughts as it relates to one. I love the fact that you've shared, most of you have shared about taking care of yourself, but also how do we take care of our communities? And then how do we take care of ourselves until we are, I wouldn't even say until we're past this, but beyond this. Well, where do you see us at now? And where do you see the future of this epidemic? And then where would you say we are now and what we need to do?
Yeah. I mean, I think the biggest thing, and this has been the language being spread, we have to flatten the curve. I think Ricardo started off by saying, we don't even have all 50 states on the same accord at a stay-at-home process. I think that's one thing. I think the second thing is because these mandates are in place, it's also important for us to follow them. And I think what's interesting is I went on a run today, ran by Kenneth Hahn Park, and definitely saw 8 brothers out there playing basketball today, which is great. But that also violates all the things that we're discussing, talking about social distancing and stuff like that. So I think at some point we really truly have to buy in. But I think it is our voice and our face, I think, hits people differently because we are not the general representation of where people are getting these mandates from. So I would charge it's on us too, right? And I think the other thing that we kind of were talking about Detroit and talking about like Milwaukee too, the statistics in the African-American community for this virus are downright scary. Because, and I think maybe this is the other overarching thing too, I think our presentations, our virulence, how strong this virus is not matching the data that we got from China. And I have had to have conversations with my friends too, when this first came out and I'm talking about the data that we had. I didn't see any data from China talking about GI symptoms as the presentation for this virus. And it turns out that that's pretty common now.
What's the GI symptoms?
So GI symptoms. So people preventing with coronavirus who just have like upset stomach, nausea, vomiting, diarrhea. And we end up testing them and they are also positive for coronavirus.
Gotcha. So that's gastrointestinal is what GI stands for? Gotcha.
Yeah. But this was not information that we had 3 months ago when this stuff was initially coming to the States. Saying all that to say, this is why it's more important for you to stay home. Treat it like Dr. Patterson said. Treat it like everybody has it.
No, I think that's the most important thing that I've gotten from this talk so far is to treat it like everyone has it. Because as you said, those brothers that you saw playing basketball at the park, probably aren't doing that. They're probably treating it like I can't get it, or if I get it, it ain't gonna matter because I may not be symptomatic, or they may not even be thinking about it. And I think this is the one thing that I do believe we need to get a message out to African American community specifically. And I really want to go around. Maybe I'll start with Dr. Patterson. You know, if you were to be able to just kind of impart one message to the African American community specifically, what would that message be as far as, you know, COVID-19 is concerned, as far as this time period is concerned right now?
Yeah, I think my focus would be, it's not about them or us, it's about all of us, right? We're just part of one community and we have a responsibility to each other. And unless we all commit to doing the same approach to staying at home, doing your social distancing, we're kind of missing the boat. And it's our job to take care of each other. It's important to have a balanced diet, to exercise. But Lucy, like you were mentioning, how are we going to slow this down? What is the end point? The end point is when we all commit to do this as a family, as a group of people, willing to do what's necessary to look out for each other. And when we see, like when we go on a run and we see the brothers playing hoop, we need to actually, even though, you know, we got to be careful about confronting people, let people know that they should be doing those social distancing and doing the things that we can do to protect each other.
Now, that's a very, very important point right there. I mean, you know, we of course, we see, you know, a lot of comedians deal with just culturally how different communities handle certain, you know, social things, right? And, you know, walking up, you know, to a group of brothers playing basketball and telling them y'all shouldn't be doing that doesn't necessarily sound like culturally how we normally would handle something like this. But we're at a different time and a different place. And so you're making a good point. Like it is that time where it's like we need to speak up and not in a disrespectful way, but in a caring way, you know, especially for you, you know, you guys are doctors. I mean, it's you pull your doctor card out and say, hey, look, I'm a doctor. I'm gonna tell you how. But now I'm gonna pull it out and be like, hey, my friend that's a doctor told me this is what y'all should be doing. Yeah. But I do think that culturally, that's an important distinction, you know, because every community has their social norms, right? And I had this conversation with my wife the other day, because a lot of things that we've been doing, we've been handling the normal way, right? We've been going grocery shopping, for instance, the normal way, getting what we normally get. And, you know, the question came up, like, should we change that and maybe get more things? Or, you know, we don't want to be a hoarder, but we also want to protect ourselves. Like, we don't want to have to go out every week to get groceries like we normally do. Maybe we need to go out once and then not go out again for the next 30 days. You know, what does that look like? So just changing our normal routines during this time is going to be important. So I definitely appreciate that. I you know, this conversation, we want to keep going. And so I wanted to just make an announcement right now that I'm going to put on our IG and on our social media. You know, if you have questions for medical professionals, and just because this is the biggest concern in the world right now, to email us or call us. You know, we have the phone number on the screen, but the phone number is 805-391-4973. And what we'll do is we'll do some updates throughout the week and into next week, just getting questions answered. So we'll have a specific, you know, hear your questions about coronavirus and COVID-19 pandemic. You know, here's some answers from some professionals. And some of those questions may be medical, but they may be other kind of questions. You know, they may be financial, right? They may be how to apply for a loan now. There's all different kind of things that are going on. And so just information is so important, but then acting on that information is even more important. You know, the worst thing we could all do is know all this stuff and not change anything, you know? So I want to just go around and give all the gentlemen, you know, a chance to share any final thoughts. Please shout out your business, what you're up to, what you're passionate about. People want to find out more information about you that, you know, from watching or listening to this, that'd be awesome. So I'll start with Britton, and then I'll come back around to all the folks. Go ahead, Britton.
All right. Well, Ricardo, thank you for putting this on. It's an honor, and it was great meeting the doctors and Lucy. And I think you're doing a great public service here. I really just want to acknowledge you for that. And for us at West LA Neurokinesiology, we're looking at creating an atmosphere for acute care biomechanical trauma, and such that they don't need to be in the hospital setting, just so they can get better. Overall, I would like us to make sure that we don't become the trope where someone's going, brothers playing basketball, but you still got governors that got a lot of money on other people that they ain't doing something. But I do agree with what we're saying to help our population, help our communities with love.
Thank you.
Branden.
I think the important thing is we talk about mental health and the impact that this pandemic has on our community. Social distancing does not mean isolation. Like, reach out to your friends and your family, use Zoom, use your FaceTime, use your phone. If you are sitting at the crib watching TV, you can sit at the crib, watch TV, and check on your mom and check on your cousin and check on all your people too, because it is something that is traumatic to all of us, and all of us can kind of work on reducing the trauma, because the virus is one thing, but the impact from the virus is another thing. So it's also important that we're working on that part too. Also just wanted to give a shout out to the nonprofit that I work with, Trap Medicine. You can check out our website at trapmedicine.org. A lot of the stuff we're focusing on is how Black men are affected in health. I mean, and the numbers show that this is a virus that is disproportionately affecting Black men. So you can check us out too. Shout out Jamil Lacey as well.
Thank you.
All right, Bryon.
All right.
Out. Close it out, sir.
So I just wanted to add something that Dr. Turner was just mentioning about the atypical presentation that hasn't been out there. One of the new studies also showed one of the first symptoms that you can get is just fatigue. You can be extremely fatigued for 2 to 3 days before you even start developing some of the symptoms. So like we said, there's just really no way of knowing if we have it or not. And we have to practice social distancing and all the things that we've already talked about. And also we need to commit ourselves to taking care of each other. That means reaching out to our family members on a regular basis, on a daily basis, especially those who are in our families that are older, who are really at risk. We really need to look out for them and do what they need done for them. So do their shopping, do things, make sure that they are not being exposed. Even people who have illnesses that we need to look out for. My practice is primary care sports medicine. It's easy to look up www.primarycaresportsmedicine.com. Our job right now is to take care of anyone who's in pain that can avoid going to the ER, the urgent care, or for any acute injuries, fractures, contusions, any of those things that you can avoid going to the ER for.
Thank you, gentlemen. And I just want to, again, give each of you kudos. Totally honored to have you on the show today. And you all have done a phenomenal job. I know that knowledge is power, and you have provided knowledge to the community. And as Ricardo has already said, we want to encourage people that have questions. They can either call or they can hit us up on our IG and be able to get questions answered. These brothers will avail themselves, I'm speaking for them, to answer future questions, because this conversation is not over. I would say, weeks from now, like I was already saying, that people are still want to know, when is it going to be over? How is it going? And so again, we will reach back out to these brothers to join us again, because we want to just continue to give our community and the world at large. And I think, Dr. Patterson, you summed it up when you said, this is not about us and them. This is all about us, everybody in this world right now. And I'm emotional about that, because it isn't about, my sister or my brother. It's about all my sisters and brothers throughout this land. And I just know that God is going to heal this land. But we have to have wisdom as well, and do the things that we need to do to be well. I mean, not just because of this current crisis, but always being well. And again, knowledge is power. So I thank you all for sharing your knowledge and expertise with us today. And again, I want to encourage people, if you have questions, here you have some experts, some great experts, some men who are definitely on top of their game, who will answer those questions at a future date. So hit us up. We want to help you to stay well. Thank you, gentlemen.
Appreciate it.
Thank you.
Thank you.
All right, and that's it for this episode of Hope Village Podcast. I mean, you please tap in with our IG at Hope Village Project, and follow us on Facebook as well, and visit hopevillageproject.com to pick up the book Hope Village and the film coming out May 12th. See you guys soon. Stay safe.